Dr. Anees earned her medical degree in Pakistan at Sindh Medical College. She completed an adult psychiatry residency at Bronx Lebanon Hospital Center, Icahn School of Medicine in Bronx, New York. She finished her child psychiatry fellowship at Nassau University Medical Center in East Meadow, New York, where she graduated as the chief fellow of her department. Dr. Anees trained in psychodynamic psychotherapy at New York Medical College in Valhalla, New York. She practices at CMH Behavioral Health in South Hill at 140 East Farrell Street. And I will turn it over to her.
Thank you, Christy. Hello, everyone. Hope everybody's doing well. Well, thank you so much for joining me today. And I would like to share a little bit of a story from my childhood to start with. So when I was about 6 years old, I remember there was a time when I was just there in my living room. Mommy was, I think, in her room, and I was jumping on the sofa. And somehow I hit the candle stand that was right there, and I broke the candle stand. And there I was, and I was looking at the candle stand, and it was staring right back at me. And I'm like, wow, what am I going to do with all these broken pieces? I knew that my mom had gotten it on her birthday from my aunt. So I was just processing all of that and really overwhelmed in that moment. And suddenly I see my mom come out of the room. She looks at me. She's like, all right, well, let's sit together and try to fix it. So that afternoon, we glued this candle stand together. And I still have that candle stand by my dresser. And till this day, when I think of it, it's a pleasant memory for me. Now I understand that actually that terrifying situation that I had built in my head all by myself, my mom just changed it into a happy memory, you know? So I just wanted to start with that before we get into the complexities of resilience. Before we really talk about how we can play a role as adults and parents and aunties and uncles in helping our children be resilient, let's talk a little bit about what resilience really is. And scientifically speaking, what we think of it. So some experts in our world of science would argue that resilience is a system and processes that participate in tuning the brain to the social ecology and adapting to its hardships. That's kind of what the construct of resilience is. The core features of resilience, they usually classify them as sociality, meaning, and plasticity. So sociality is basically, you could see that across all animal evolution, is basically a coordinated action among organisms that enhance survival of the group. Whereas plasticity, you can see it in any living matter. It implicates flexible adaptation to changing conditions. And meaning is very specific to human beings because we can inspire strength in the face of traumatic events, in the face of adversity. Now, to give you a little bit more on plasticity, plasticity relies on neurobiological systems that underpin social fittedness, physical stamina, and endurance as they flexibly adapt to diverse conditions. Neuronal plasticity is basically the way our neural networks in our brain, they show change through growth and reorganization. I would like to mention here that over the years, research has shown that the adult brain, the adult human brain, is very plastic, meaning it can be altered throughout the years. But more so what we have seen is that the developing brain exhibits a very higher degree of plasticity than the adult brain. And that's why, for resilience, childhood really matters. And that's why, kind of like we know what we do to the little ones, their brain is changing. So we can do a lot of positive things. Now, there is a hormone that we know mostly in reproduction. It's called oxytocin. That hormone plays a very important role in bonding, in social recognition, and maternal behaviors. It is implicated in neural plasticity at a molecular, cellular, and a network assembly level. Now, what does that really mean for us? So it means that, we are thinking that, is there an impact of maternal depression on a child's mental health? Because if bonding for a human being is coming right from the beginning of his life or her life, which is provided by the mother. So I looked up some data on that, and I would like to just talk a little bit briefly about this study that was done in 2013. So they studied about, it was I think 103 mothers with no history of depression and 46 mothers who had a history of depression. And then they found out that the 61% from the group of mothers that had a history of depression, 61% of their children ended up having a psychiatric diagnosis, like anxiety or oppositional defiant disorder, versus only 15% out of the 104 in the study who had psychiatric diagnosis. So what does this really mean? We have kind of like said, plasticity is important for resilience. Resilience also depends on bonding. Bonding is related to a hormone, oxytocin. So if you kind of just think about this says a very important thing to us. The key takeaway is that it's very, very important for us to treat our women who have postpartum depression or who we think are at risk for postpartum depression. I would like to take a moment here to thank all my family medicine colleagues, to all my OBGYN colleagues who send us patients in a timely manner. Because you're not just helping the woman, you're also helping the infant who she is caring for. And you're helping us prevent subsequent postpartum depression, obviously in later pregnancies, if they were to get pregnant again. Well, having said all that, now what are some practicalities? What can we do as adults? What role we play in making our children more resilient? So first thing is, anyone would say, hey, improve the child's confidence, praise the child, say good job. But I do want to emphasize there is a way of praising children. I would really like to say this thing, that when you're praising a child, praise the effort and not the outcome of what they have done. Let's say, oh, you were supposed to build something, build a house. Oh, I loved how you put an effort to do it. So the emphasis should be on the effort and not the outcome. When you praise the outcome, in a lot of ways, you're putting so much pressure on that little one that, oh, if I don't get to this next time, I'm not going to get that validation from my parent. So I really like how Susan Newman, who is a great parenting expert and social psychologist, how she talks about encouragement. Encouragement is effective because A, it allows you to select a characteristic you want to foster in a constructive way, and B, it lets you call attention to the process and make progress in building your child's confidence. So now I really want to look at the scenario with these two children, right? One did not get a good grade. So what we should say, or ideally what we are trying to do, is I like the effort you put into the test, maybe a bit more next time. Now, when the child did really well, you're still saying, hey, you just proved to yourself you should never give up. Like, you see how it's not really on the outcome, it's on the effort. And that's where encouragement is. So I think that's really key. And those are some things that we can really do as parents and adults for our little ones. Another thing that helps, that plays a very significant role in resilience is the way the child copes. So children appear to be very confident, but they can fall apart when structures are changed, when things are not according to their plan. True resilience is seen when children face adversity. and how children manage their emotions during those times. Now, I'd like to give you another example. Like back in the day, I remember when I had to go play with my neighbor, I had this phone that I had to remember the number to call her. And then my neighbor's mom would pick up and I had to ask her, can I come play with my friend? And if she says no, I had to have a plan B. What am I going to do next? Am I going to play with my Barbies? Am I going to go play with my brother? You know, or am I going to throw a tantrum, right? So, and think about it. And now compare some parents who would be like, oh, you want to go play with your friend? No problem. I'll just text the mom, the plan is ready, and you had nothing to do with the process, but you get what you wanted. Developmentally, these things are very important. At such a little age, at 4 or 5 years old, the child is already learning. Okay, when I don't get this, how would I react to it? Or what can I do next? So helicopter parenting is what we were talking about just now, when the parents accommodate the child. And it's been proven to be very counterproductive. We need to question ourselves. Are we accommodating more as parents? There is research done which shows that higher degrees of accommodations leads to severe anxiety symptoms. There is Dr. Eli from Yale University started this program. It's called SPACE. It's actually a simple idea that he uses to combat a child's anxiety by reducing parental accommodations. If you are interested, this is something, it's very interesting, and I think it's a very good different approach other than CBT, you know, which helps us deal with a child's anxiety. So another thing that I wanted to mention is from this book called The Self-Driven Child. Children don't need perfect parents, but they do benefit greatly from parents that can serve as non-anxious presence. Also, another thing that builds bonds and then that helps us taking things easy is a little bit of humor. So when you are doing a behavioral plan with a child, let's say, oh, everything is all over the place in the living room, we gotta clean it. So be silly, you know, try to make a joke out of it. Hey, who's gonna be the boss? Maybe you can tell me what mommy should clean and you can do some of the cleaning. So the lighter you are, the lighter the child takes it, you know? So the lighter approach, it helps stress levels of both children and parents. So let's say, oh, it's COVID, we can't really go out to eat, but we can do a little pizza party at home. You know, so we have to really understand how we are doing when we are establishing these things and expecting the child not to be anxious. So I think humor is a really great tool to be used in life in general, in my view, as a psychiatrist. And then we'll hit a little bit more on modeling. So the same thing, that if you are doing well, you know, your child is watching you all the time, you know, so taking care of yourself for that modeling is very important. If you are worried, let's say you're really worried about COVID, oh my goodness, what am I going to do? All my flights are canceled, I can't have a trip. And then when the child asks you, oh, don't worry, it's nothing, you know, and then you bring the child to therapy and they're like, he's just freaking out about COVID. I don't know why, you know, because think of it. If you had asked that question to me and I'd said, hey, don't worry, it's nothing. I mean, it doesn't really give you that satisfaction in the answer, right? So we want to empathize, but then we also want to give them the facts. Hey, this can happen, but these are the things we can do to prevent it. And so same thing, like if we are overwhelmed or we are overtly anxious about things and we are all over the place at home, then we are not modeling. And I think we, from time to time, we need to really think about these things and how are we doing? We have to show some grace to ourselves and get the help that we need. So I highly encourage people who are dealing with things, moms, dads, who are struggling with anxiety to reach out for help. And we talk about a lot of things that we should do, but there is a thing that we should never do, and that is invalidating statements. The effects of recurrent invalidation can have lifelong consequences for children. There was a study done in 2019 that found that parental invalidation could predict non-suicidal self-injury in children. Now, obviously, what is validation? When we talk about validation, we always talk about, when we talk about invalidation, we talk about validation. So validation is a non-judgmental acknowledgement of the person's thoughts, values, feelings, and behaviors. So I would like to give you an example. Let's say a child breaks their sibling's toy, right? I'm not saying that we validate the action, that, hey, great, you were upset, so you broke, your sister's toy. But we are validating the emotion that that child is experiencing. So when the child breaks the toy, after that, you can say, hey, it seems like you were really angry and upset. That's the beginning of the conversation. So that's kind of like you validate what the emotion the child was experiencing. And then once you start the conversation, it will come up, and then, you could go on to say, oh, what could have you done instead? And then the child would say, okay, maybe I could have gone to my room. Maybe I could have written something, listened to music and whatnot. But just saying that, we are not saying that validate the wrong action, but validate the feeling. And when, after validating the feelings, there will always be a time to talk about your feelings. So remember, the goal is not for us to have conflict escalation. The goal is for conflict resolution. So yes, when your child does something bad at a birthday party, they did something and you're like, do you understand how it made me feel? So we don't want to make it about us right from the beginning. There will be a time in that conversation when you could say, hey, would you like to know how mommy felt? And if it's necessary, you could go into all that, but that's not how we want to start that conversation when the child has done something. So those are some of my thoughts on parenting and tips for resilient children. This is one of my very favorite quotes that I would like to end the presentation with, by Maya Angelou. You will face many defeats in your life, but never let yourself be defeated. These are some of my book recommendations. Kid Confidence, Little Things Long Remembered. It's a great book by Susan Newman. And there is a good TED Talk, How to Raise Successful Kids. And then The Scaffold Effect is, I think, a relatively newer book. And these are some of the references. So if you would like to read those articles that I'd mentioned, the research, they should be available here. And thank you very much for listening. And thank you for your time. If there are any questions, I'll be happy to answer.
Thank you, Dr. Anees. That was awesome. If you all would like to ask a question, feel free to unmute your microphones, or you can type it in the chat. Well, I've got a question while we're waiting to see if anybody else thinks of any. In the study that you gave at the beginning, where the kids ended up with anxiety, is that because it was hereditary or because the moms did not bond?
Right, that's an excellent question, and that is why I chose that study. So, to go into some details of that study, yes, they did test saliva and the oxytocin levels of the family members at 6 years old of the mothers who were depressed, and they did find a consistent lower level of oxytocin. And they also studied a SNP, which is like a genetic change in that oxytocin gene, which was also relevant. Excellent question, Christy. And it really means that, yes, everything matters. So it's your genetics that matters. But on a positive note, there are a lot of modifiable things that we can do that matter. And so, if we had treated, let's say, this postpartum depression and the mother was able to bond, we would have had probably, or, possibly a different outcome. So, yes. So you are absolutely right. The bonding plays a role, which is, not all genetics, right? But then there is that element of oxytocin. And that's why I brought in those slides, just to kind of shed some light that, all of these things are really, we can make a difference. It's all not just A to B genetics. There are a lot of things that we can, have an effect on. So yes, thank you for that question. That was a great question.
If anybody else would like to ask a question, we have about 5 minutes left. And Dr. Anees, we have a question in the chat that says, I would like to know how you would advise parents to better prepare children for the real world in the current situation given the pandemic.
Again, excellent question. And I think we touched base a little bit during the presentation, and I would like to go in a little bit of detail with that. Like, fake reassurance, I think, doesn't really work for children, So just saying, don't worry, hey, it's okay, mommy got this, if they, children are exposed to media these days, and I certainly don't encourage watching social media or news all the time, because with the pandemic there has been a lot of negativity. But when there is a question, it's a good approach to have a reasonable conversation with them, not all the details, but at least enough for them to understand, yes, there is a problem, but look, scientists have worked and we have a vaccine for it, and we are doing better, and be realistic. And there are certain things that we can do, like wash our hands, keep our mask on. So whenever you're dealing with a problem with a child, you look at the problem as a problem, you empathize with them. Yes, that's a good question. I understand your feelings. You're worried about grandma or grandpa, but then you want to introduce a little bit of that problem solving. And the point of those things is to teach the child problem solving, so that next time, when they have something, they don't just go like black and white, that, hey, this is going to be either the end of the world or this is going to be great because my mommy will make it great. But they have a little bit of thinking going on. The point is to encourage them to think, ask questions. So I think being real with them and having conversations and not giving them too much information, which is unnecessary, helps. But if there is a question, I would say break it down and sit with your child and talk to them about it. I hope that answers the question.
If anybody else has a question, feel free to ask. We have about 3 minutes left. All right, well, I don't see or hear any other questions, so we can go ahead and close out. But just so everybody knows, we'll have the recording posted on our website and Facebook page in case you missed it, if you want to share it with your friends. Very informative. Thank you so much, Dr. Anees.
Thank you very much for having me. Really appreciate it.
Bye-bye, everyone. Thank
Bye.
you.
Thank you.